Welcome to the deep dive. So, you've probably come across telemedicine, right? Maybe even had a virtual appointment.
It's becoming pretty common.
Yeah, exactly. But today, we're going, a bit deeper than just the convenience factor.
Right.
We're digging into a bunch of sources. We've got insights from big names in healthcare quality, like Joint Commission International, NABH over in India, ISQA.
The International Society for Quality
No,
in
no, no.
Healthcare, yeah. Global players.
Global players, exactly. And also consultants like Supremedic, plus material from the QI Playbook podcast and various articles.
It's a good mix of perspectives.
It really is. And our goal here, our sort of mission, is to figure out how telemedicine isn't just, a handy tool, but is actually fundamentally driving better healthcare quality, better outcomes, efficiency, patient experience, the whole package.
Absolutely. It's about understanding its role as like a key engine for improvement, moving past that surface level.
Okay, so let's unpack that. First off, when we say telemedicine, what exactly are we talking about? Just video calls?
Well, it's broader than that, though. Video is a big part. The QI Playbook gives a pretty solid definition.
Okay.
They describe it as using digital communication tech. So yeah, video calls, but also text, mobile apps, that sort of thing.
Right.
To deliver healthcare services remotely. So consultations, diagnosis, follow-ups, monitoring.
All without needing to be in the same room.
Exactly. So instead of the waiting room, you're maybe on your couch.
Which sounds great, but the big question is, how does that virtual link actually boost the quality of care, the standard you receive?
Yeah, it's the core of it. And the impact is, well, it's multifaceted. One huge thing mentioned across the board, really, is better access.
Access to care.
Yeah. Especially, for people in rural areas or places without many specialists nearby. Telemedicine basically bridges that distance.
So someone in a small town could see a top specialist from a major city.
Potentially, yes.
Yeah.
We saw data suggesting quite a big jump in specialist consults for patients in remote areas who just didn't have easy options before.
Wow, okay. That alone feels like a major quality improvement, bringing expertise where it's needed.
Definitely. It tackles those health disparities tied to geography.
What else? What other ways does it boost quality?
Cost effectiveness comes up a lot.
How so?
Well, think about it. Fewer in-person visits mean lower transport costs for patients, potentially less overhead for clinics.
Less need for physical space, maybe?
Right. And it can even mean fewer unnecessary trips to the ER or hospital admissions, which saves a lot system-wide, makes the whole system more efficient.
Okay, so it's not just easier, it's potentially more sustainable, too. And I guess the convenience must impact how patients feel about their care.
Oh, absolutely. That convenience often leads directly to higher patient satisfaction.
Makes sense.
And when it's easier to connect, patients are often more engaged. They stick to their treatment plans better.
Which should mean better health outcomes down the line.
Exactly. Plus, it really helps with continuity of care. Like for managing chronic conditions where you need regular check-ins. Telemedicine makes that much easier.
Yeah, I can see that. More proactive management instead of just reacting when things go wrong. And what about wait times? That's a common frustration.
Right. Telemedicine can slash those wait times significantly. Faster access usually means quicker diagnosis, quicker treatment starts.
Which can make a huge difference for some conditions.
A massive difference. So you see, even just fundamentally, how it connects to all these different aspects of quality.
Okay, yeah, the potential is clear. So now, let's get more specific. How is telemedicine actually moving the needle on those quality metrics that hospitals and clinics track?
Right, the measurable stuff. The QI Playbook had some really good examples here. Let's take patient-reported outcomes, PROMs.
Okay, PROMs. How does telemedicine help there?
Well, these platforms allow for, continuous monitoring. Patients can report symptoms regularly through an app or a quick virtual check-in.
Instead of waiting weeks for the next appointment?
Exactly. So the care team gets a much more real-time picture of how things are going. They can adjust treatment plans much faster if needed.
So a more dynamic view of the patient's health. I like that.
Precisely. Then you've got efficiency metrics, things like cycle time.
Which is, what, the time from seeking care to getting a diagnosis?
Yeah, basically. And also throughput, how many patients a provider can see. Telemedicine can shrink cycle times because you remove the travel and waiting room delays.
And potentially increase throughput.
Potentially, yes. Providers might be able to manage more patients effectively, especially for follow-ups or less complex issues, without sacrificing quality.
That's the key, right? Efficiency without losing quality. What about teamwork? How does it affect how doctors and specialists work together?
It can really improve care coordination and communication.
Hmm.
Think about a primary care doc needing a quick consult with a specialist. With telemedicine tools, they can connect easily, share information digitally, and collaborate faster.
Rather than playing phone tag or waiting for faxes.
Exactly. Much smoother, especially for complex cases needing input from multiple specialists.
Yeah, that sounds incredibly valuable. And we touched on it, but that specialist access, it feels like a game changer, especially outside big cities.
It really is. It breaks down those geographical walls. Our sources show this leads to actual demonstrable improvements in clinical outcomes in areas like, say, cardiology or stroke care in remote places.
Wow. And finally, what about the big clinical outcomes like hospital readmissions or ER visits?
Yeah, the evidence there is growing too. Insights, including from the QI playbook, suggest that for certain conditions, especially chronic ones,
Like diabetes or heart failure?
right, telemedicine interventions like remote monitoring or regular virtual check-ins can help reduce readmissions and cut down on unnecessary ER trips.
How? By catching problems earlier?
Exactly. Early identification, timely intervention. It's about being proactive, preventing things from escalating to the point where you need acute care.
Okay, that makes a lot of sense. So let's zoom out again. There's that framework, the Institute of Medicine's 6 dimensions of quality. How does telemedicine fit into those?
Ah, yes.
Yeah.
It actually maps quite well across all 6. It shows just how comprehensive its impact can be.
Okay, let's tick them off. First, access.
We've covered that quite a bit. Bridging geography, supporting continuity, especially for chronic care, mental health. It definitely expands access.
Got it. Next, safety. How does being remote improve safety?
Several ways, actually. One is infection control, which, as JCI notes, became super relevant recently. Fewer people in waiting rooms means less spread of infection.
Good point.
Also, remote monitoring with wearables can give early warnings. And think about virtual pharmacist visits for medication reconciliation, catching errors.
Interesting. I hadn't thought much about the infection control angle. Okay, what about effectiveness? Does the treatment work as well virtually?
Well, platforms are getting smarter, integrating evidence-based decision support, plus those quick specialist consults we talked about, EICUs, telestroke programs, getting critical drugs administered faster. That's all about effectiveness.
Right, getting the right care faster. And patient-centeredness. I imagine patients like the convenience.
Hugely. Convenience, less waiting, but also empowerment. Access to educational materials, personalized plans, tracking symptoms themselves. It puts the patient more in control.
Yeah, fitting care into their life, not the other way around. And timeliness.
Definitely speeds things up. Faster triage via virtual consults, quicker follow-ups after discharge to catch issues early and avoid readmission. It hits timeliness hard.
Okay, and finally, efficiency. We mentioned costs, but what else?
Beyond cost savings from fewer ER visits or no-shows, there are operational efficiencies for the hospitals and clinics. Less need for physical space, maybe smarter staffing. Resources can be redirected.
It really does seem to touch every aspect of quality. Now, what about those organizations you mentioned earlier, JCI, NABH, iSQA? What's their take?
They really reinforce this picture. JCI, as a global leader, pushes for zero harm, high reliability. Telemedicine fits right into that continuous improvement model they advocate.
So they see it as a tool for reaching those high standards.
Absolutely. And NABH in India focused on setting standards there and meeting patient needs. They also recognized telemedicine's role in boosting access and convenience, which aligns with their quality goals.
And iSQA, with their international reach.
Yeah, iSQA is all about sharing knowledge and promoting quality improvement globally. They're naturally involved in exploring and promoting best practices in telemedicine as part of that broader quality mission.
Makes sense. And Supremedic, the consultants.
Their work helping hospitals with accreditation just shows that the industry sees telemedicine as pretty essential now for meeting modern quality standards and running effectively. They help put the pieces in place.
So it seems like there's broad agreement on the potential, but like any big change, there must be challenges, right?
Yeah.
Barriers to making this work perfectly for quality improvement.
Oh, absolutely. It's not without its hurdles. A major one, highlighted in the QI playbook, is the digital divide.
Meaning not everyone has good internet or a smartphone or knows how to use them.
Exactly. Access to the tech and digital literacy. It can create inequities, leaving behind older adults or people in really remote or low-income areas.
That's a critical point. We can't let technology widen healthcare gaps. What else?
Data security and privacy, huge concern. You're transmitting sensitive health data online. You need robust security, strict compliance with privacy rules like high pay to maintain patient trust.
Non-negotiable, really. Trust is everything in healthcare.
Totally. Then there are the clinical limitations.
Right. You can't do a hands-on exam remotely.
Precisely. Some things just require an in-person assessment or procedure. Telemedicine isn't a replacement for everything.
And getting paid for it. Reimbursement.
Yeah, reimbursement can still be tricky. Policies have improved, especially recently, but there can be inconsistencies in what insurance covers, which can slow down adoption.
And making the tech work smoothly. Integrating it.
That's another big one. Integrating these new telemedicine platforms with existing electronic health record systems, EHRs, and the clinic's workflow. That can be complex, technically and logistically, but it's crucial for continuity.
Okay, so real challenges to navigate, which leads us to, what are the best ways to actually do this well? What are the strategies for maximizing the quality benefits of telemedicine?
Good question. The QI playbook had some solid advice here. First off, training for the providers.
Not just how to use the software, but how to deliver care virtually.
Exactly. It's a different skill set. Communicating effectively, building rapport remotely, knowing the clinical nuances of virtual care. It requires specific training.
Makes sense. What else?
Monitoring key metrics. You have to track if it's working, patient satisfaction, access rates, follow-up adherence, clinical outcomes. Measuring helps you refine the program.
Data-driven improvement and tackling that digital divide.
Yeah, actively working to improve digital access. Maybe offering telephone options as alternatives, providing resources or support to help patients get connected, addressing the equity issue head-on.
Crucial. And getting the systems talking to each other.
Yes. Seamless EHR integration. It's vital for accurate data, avoiding duplicate tests, ensuring everyone on the care team has the information they need.
And underpinning it all.
Security. Using secure, compliant platforms. That has to be the foundation to protect patient data and maintain trust.
Right. So it's a combination of people, process, and technology with a focus on equity and security. Okay, looking forward then. What's next for telemedicine and quality?
The future looks pretty exciting based on the trends. The QI playbook points to more AI and virtual health assistants.
AI. How would that work?
Think about streamlining things. AI could help with initial symptom checks, answering common questions, maybe even continuous monitoring with alerts if something seems off. It can free up clinicians' time.
Interesting. Taking some routine tasks off their plate. What else?
Just wider acceptance and integration. As policies evolve and insurance coverage gets more consistent, telemedicine will likely become just a standard part of healthcare delivery. More routine, more accessible.
So less of a novelty, more just how healthcare works.
Pretty much. And all the data generated through telemedicine combined with analytics that points towards more personalized care.
Tailoring treatments based on real-time data.
Exactly. Leveraging that individual patient data to create really customized, effective care plans.
So it's definitely not just a blip. It seems like a really fundamental, ongoing transformation.
Absolutely. It's here to stay and will keep evolving.
Okay, so as we wrap up this deep dive, what are the main things you want our listener to take away from all this?
I think, first, understand that telemedicine is really changing the game in healthcare delivery. It's driving real improvements in access, efficiency, patient experience, those core quality elements.
It's not just theory. The impact is measurable.
Right. Better outcomes, better coordination, better efficiency. But second, we have to be smart about it.
Yeah.
We need to tackle those challenges, the digital divide, privacy, clinical limits head on.
Can't ignore the hurdles.
No. And third, using best practices, training, measurement, integration, security is key to actually getting those quality benefits. It's about thoughtful implementation.
So it's way more than just convenient calls. It's a strategic tool for making healthcare better across the board, safer, more effective, patient-centered, timely, efficient.
Exactly. It's about building a system that genuinely works better for patients.
And that leaves us, and you, the listener, with something to think about, doesn't it?
It does. As telemedicine becomes more and more woven into the fabric of healthcare, the big question is, how do our healthcare systems need to adapt? Their infrastructure, their training, their policies. How do they need to change to really harness all this potential for ongoing quality improvement and create a truly patient-first experience?
Definitely something to consider as we all see healthcare continue to evolve.